For over a year, public health measures dramatically wiped out most common colds, the flu, and other respiratory viruses. But some are back and sending kids to hospitals.
But now we're seeing a surge of respiratory infections. So it looks like it would be October, November. So common respiratory infections, which unfortunately in kids can be really severe.
A group of viruses that cause different types of respiratory infections, including croup in children, is rising fast. Symptoms can include fever, runny nose, and cough. Most kids recover on their own, but doctors are also worried about another virus.
The most dangerous one, and the one we really don't want to see much of, is called RSV. And it can be so severe that it brings infants and usually toddlers into the intensive care unit, sometimes on ventilators.
American health officials recently issued an alert warning doctors about increased RSV activity. RSV is the most common cause of bronchiolitis and pneumonia in infants.
So what's happened to us is we had no exposure.
Over a year, kids usually come in contact with several viruses, which allow their immune system to develop antibodies. No exposure means no antibodies, but people are now mingling again.
So for children under 5, the next few months are likely to be associated with a lot of first-time viral infections,
including the flu. Some fear this season could be one of the worst for people of all ages. Britain now plans to offer flu vaccines to children as young as 2.
They're not a huge cause for alarm for most kids. But that being said,
this doctor's advice, get the flu shot, wear a mask, and stay home when you or your child is sick.
Maybe we're all willing to sacrifice that in terms of not exposing each other when we do have respiratory symptoms. And we could probably make a lot of headway against these viruses.
Because we've learned simple measures can save lives. Christine Birak, CBC News, Toronto.